welcome to Let's Talk Health Live. I'm Dr. Amanda, I'm a naturopathic doctor, and tonight we are having our live Q&A, our live health Q&A. So if you are new here, welcome. This is where you guys ask me questions in the chat and then I answer them for you. So anything health related, feel free to ask and I will answer them in the chat. I usually start off with talking about some sort of topic just to get things rolling, and then you guys can ask me any questions and we will go through them. All right, normally I have my whiteboard. I'll see if it will work because I know this is kind of backwards. That's a little bit, but so why don't we just talk about poop color? So different colors of poop and what that means. So generally, let's also talk about what a normal bowel movement should look like. So when you're having regular bowel movements, what that means is you want to be going every day. So bowel movements should be 1 time a day, up to 3 times a day is considered a normal bowel movement. You want your bowel movements to be formed, so not too mushy, not liquidy, and then not hard. So we don't want hard bowel movements or hard stools where you're straining and you're having to try to go. So normal bowel movement, 1 to 3 times a day, easy to pass, and formed, nice and formed. The other thing is looking at the color of it. So that's why I'm talking a little bit about the poop colors today. So the color of it should be a brown color. So when we're looking at the stool, anywhere from a light brown to a dark brown, that's what's considered normal. So your stool does get its color from foods that you eat for sure, but a lot of it comes from the bile, and bile is produced in our body to help with digesting. So a normal poop color would be anywhere from a light brown to a dark brown. Now let's talk about different kinds of colors of poop. So what about if it's green? I get this question often, like, what does it mean if my poop is green? Is that normal? So let's talk a little bit about that. So if you have green poop, it could be due to something that you ate. So let's say you ate something like green vegetables or something that had green or blue, even blue food coloring or green food coloring in it. A lot of times, like chips and snacks and stuff that have food dyes can change the color of your poop. So if you notice that you had green poop, it could be just looking back at what you ate and seeing if potentially it was green or it was had food colorings in it and it caused your poop to be green. Okay, so if anybody is just joining us, hi and welcome. I'm Dr. Amanda, I'm a naturopathic doctor. This is Let's Talk Health Live, where we talk about different health topics and you guys ask me your questions in the chat. So feel free to drop any health questions in the chat and I will answer them for you and we will go over, your health concerns. Okay, so I'm talking a little bit about different types of poop colors. So if you guys just joined us, brown, anywhere from light brown to a dark brown is considered normal. If you have green, it could be due to something that you ate, like food coloring or green veggies. The other thing it could be due to is an infection. So potentially there was something, you got food poisoning, maybe you ate some spoiled like vegetables or something that was just off. So usually if it's green and it's more mushier, then that could be due to a food infection. Sometimes even medications and supplements can change it, so that's something just to keep in mind. So generally, if it's green, it could be normal because it's something you ate, but could also be something else going on. All right, so we have a question, so let's get to this. So I'm on interferon, which is a medication. I tend to go every 3 days. I go from diarrhea to constipation. Yeah, so I had mentioned at the beginning, regular bowel movements, you wanna go once a day. And you want it to be formed and easy to pass. And you don't want it to be diarrhea where you're having loose or mushy stools, and you also don't want constipation. So most likely because of your medication, it can be interfering with your bowel movements. And that's really hard when you need medication for something, but then it's interfering with your bowel movements. So some tips that I would give to kind of help with regulating your bowel movements is assessing how much fiber you're having in your diet, making sure you're having a good amount of fiber, so fruits, vegetables, and nuts and seeds. Then you could also make sure you're hydrated. So staying hydrated is so important. So even if you have like loose stools or diarrhea, you really do want to make sure you're getting enough hydration. So hydrating with water, maybe adding in some electrolytes into your water to make sure you are hydrated. That can help with both constipation and diarrhea. So both of those things could be beneficial. Now, if you are going every 3 days and, you know, if anybody here is like more so constipated, doing something like a magnesium citrate powder can be helpful for just getting those bowels moving a little bit easier. So that's something you might want to consider doing as well. Okay, so if anybody's just joining us, hi and welcome. This is Let's Talk Health Live. I'm Dr. Amanda, naturopathic doctor here. If you're new here, be sure to subscribe, like this video. I do appreciate it so much, you guys, when you ask questions, when you engage, when you like the video. It does help it get it noticed across YouTube. And then also, if you haven't joined our community, be sure to join our Let's Talk Health community and you'll get notified when I go live. All right. Thanks so much, everybody. Okay, so we answered the question about diarrhea, constipation. If you have more, if anybody else has a question about that, just let us know. And I'll also talk about poop colors too. So somebody's stool they're talking about looked more like tapioca pudding. Yeah, so that would be more of like a mushy stool. So we want to work on having that to be more formed. When stools are more so mushy, it could be that you don't have enough fiber in your diet. You could not be absorbing your nutrients as well if they're kind of just passing through you. So, all right. What else? Okay, so we were talking about different colors of poop. So I talked about green, how that can be due to either something you ate, like a lot of people tell me that Takis, they eat like the blue heat or the green one and it turns the color of their poop like a greeny blue, so that can be normal. It could also be if you ate something that potentially caused a bacterial imbalance. So if you had something that had some food poisoning in it, potentially could have caused that as well. Now, why don't we talk about another popular color that I get asked about a lot, which is red. So what does it mean if your poop is red? Now, this could be blood. If you are noticing specifically like blood on your stool or blood when you're wiping. So if you do notice blood, I always say it's best to get it checked out, because if you see blood in your poop, it could mean that there's an internal bleed going on. It could mean that there's colitis, or which is inflammation in the intestines. So if you're noticing blood, get that checked out. But it could also be lower bleeding, like if you had a hemorrhoid or if you had a fissure, which is basically like a crack in the skin, that can cause it as well. And that's not something that's as concerning. So if you do see red, you usually recommend getting that checked out to see what's going on there. So, okay, so we just had some new people join. So hi everybody, I'm Dr. Amanda. I'm a naturopathic doctor. This is Let's Talk Health Live, where you guys ask me your questions and I answer them for you. So just feel free to put them in the chat box and I'll answer any questions you have. And of course, if you are new here, be sure to subscribe, like the video. I do appreciate it, guys. So thank you so much. Okay, so let's see if there's any other questions. Okay, so one question, what's my specialty? So as naturopathic doctors, we don't have a specialty, but we do have like a primary focus. So my primary focus is on gastrointestinal health and also women's health. So those are my kind of two. There was a question, there was a comment about hemorrhoids. Yeah, so I think you're commenting about the blood. Yeah, so hemorrhoids could cause that. Okay, just comments about checking your stool. Somebody doesn't have a colon, so potentially they had to have their colon removed, which can happen due to many different things. So, for example, if you had cancer or if you had a perforated bowel, sometimes your colon might have to get removed. So thank you for sharing that with us. Okay, ulcerative colitis was what they had mentioned. So yeah, so with ulcerative colitis, sometimes, unfortunately, if it's pretty extreme, you have to have your colon removed. Okay, so we're getting some questions coming in, so I will answer them, and then all of you that have just joined us, hi and welcome. This is Let's Talk Health Live, so drop your questions in the chat box and feel free to like, subscribe. I do appreciate it, guys, so thank you so much. Okay, what do you recommend for people on a keto diet that causes constipation? Great question. So generally, with a keto diet, the reason why you're getting constipation is usually because you're not having as much fiber. And that's because you're eliminating more carbohydrates, right? You're focusing more on a protein and fat-based diet, and that can make you then get constipation if you're not having enough fiber. So there's a couple things that you could do. If you're within like your net carbs and you're able to have more fiber, then you can try to do things like ground flax seeds or even a fiber supplement. So having like a fiber supplement that you mix in water, you can do something like that. You could try to have more nuts and seeds because they do have more fats in them and usually have a better like net carb ratio. So we're just talking about like the keto diet and what you can do to increase that. Let me just go back to the question. Okay, and then the other thing I would say, we'll trying to do some sort of supplements for that. So something like a digestive enzyme, whenever we're working on supporting digestion, that should help with relieving constipation because it's getting you to digest and move things along better. So if you're on a keto diet, you could take a digestive enzyme. And then I had previously mentioned magnesium, the citrate form, that can help with bringing water into your intestines and then acts as like a very, very mild laxative in the sense of it's just increasing hydration and helping you have better bowel movement. So that's what I would say for the keto diet. So feel free to ask me a follow-up question. Thank you for your question. If it was helpful or if anybody else found that helpful, please give this video a like. And thanks everybody for watching tonight. Okay, let's see. What food should you avoid that make inflammation? That's a good question. And on the top of my mind, like the number one thing that can cause inflammation is a high sugar diet and high processed foods. I'm not one to really say you have to avoid like whole foods. So pretty much if you're following like lean proteins, chicken, eggs, beef, veggies, fruits, all of that, nuts and seeds, you're gonna be getting a good anti-inflammatory diet. But the ones that you would want to avoid are gonna be things like high sugary foods, processed foods, and fat foods. And that can cause inflammation in the body, which is a kind of a vague term, but what it could mean is like, okay, if you're having processed foods and a lot of sugary foods, that's gonna cause high blood sugar, which then causes inflammation. Or potentially, if you're having a lot of processed foods, that can cause some issues with your gut microbiome, and then that can lead to inflammation. So if there was a specific food you had, let me know. I hope that was helpful. It looks like some people are saying that they've liked and subscribed. So thank you guys so much. Thanks for the like and subscribe. That's super helpful. I appreciate that so much. Is colon cancer genetic or lifestyle? Such a great question. And sometimes with cancer, it is so hard to know because sometimes people get cancer and they don't even have that in their families. But there are some times that it can be. So I would say generally, and this kind of with any sort of health disease, if it's in your family, the chances of you getting it are a little bit higher than somebody that doesn't have it in their family. So there can be a genetic component. And then there can be a lifestyle and diet and just so many other things that can impact your overall health that can cause, not necessarily cause cancer, I shouldn't say, but that can make you more susceptible to getting it. So great question, but yeah, that's what I would say. Somebody has more loose stools from being on keto. So sometimes that could happen in the beginning, your body just adjusting to things. So potentially this person is having more loose stools where the other person I mentioned they were having more constipation. Poop color, yes, we were talking about poop colors. Now I'm just going through other questions that you had. Okay, so and then also, if anybody's just joining us, welcome. This is Let's Talk Health Live. I'm Dr. Amanda. I'm a naturopathic doctor. I host this live every night. So thanks guys for jumping on tonight. But I do go live every night. So be sure to subscribe and turn on notifications. That way you do get notified when I go live next time. If you're going keto, might as well go 1 meal a day keto. I think that just depends on everyone's personal preference. Turmeric and ginger tea, good for intestine. So turmeric and ginger are great, super great anti-inflammatory herbs, really nice and soothing for your gut health, really soothing for a, if you have inflammation going on, if you have an upset stomach, but also great for things like joint pain and liver health. So I'm a naturopathic doctor, so I did mention that. What else? Okay, this is such a good question. Is it disordered or unhealthy to eat the same thing every day? Such a good question. So I wouldn't say it's like unhealthy, but I would say it's not as healthy as if you had a more diverse diet. So there are studies that show the more diverse your diet is, which means like the more variety that you have in your diet can help out with your good gut bacteria. So sometimes like just some tips that I give patients are like, let's just say you normally choose to eat like yellow onions, for example. So a quick thing that you could do is start having more red onions, just like swap it out for something, a different color. Let's say you normally have green apples, switch it up and have like red apples. Even just a small switch like that can be so beneficial for your microbiome. And then just trying out new foods and having different variety in your diet can be so beneficial for that microbiome health. So thank you for that question. I hope you found that helpful. And then also, if anybody is just joining us, this is Let's Talk Health Live, so drop your questions in the chat box. If you have a follow-up question, if I answered your question, you have a follow-up question, just write it down and I will get back to that. And if you did find it helpful, please like and subscribe and join our community. Okay. How do I control craving? Such a good question. I think this varies depending on the individual. So what I would say is like sometimes when you're having a craving for something, you want to just kind of assess what's going on. Are you craving, like actually craving something? Are you hungry? Are you potentially thirsty? Are you stressed out and you're just wanting to have something? So it's more so kind of just assessing like where you're at and what your thoughts are before you go and do that. If if you're actually maybe hungry for something, have something that's more nutritious. If you're thirsty, have something to drink. If you're stressed out, maybe just taking a deep breath, relaxing before you go and jump to having the cravings. Now there are some like supplements and herbs and stuff that can help out with it. So rhodiola is a good one. Relora is another good herb. And then your B vitamins can also help out there too. So that's just what I would say. So, all right. What else? Is a colonoscopy important for over age 50? So that's generally what's recommended is the age 50 up. If you have a family history of cancer, sometimes it's recommended earlier on. So I would say it's important because sometimes we're given these screening tools that can help with assessing for cancer, and why not do them if the benefit outweighs the risk? That's something you would assess personally, but I would say something like colonoscopies, pap exam for women, just getting things checked to see if there's any precancerous cells can be so beneficial. So great question. Okay, so we are answering the questions here. Let's see what else. And I was talking about poop colors, but let's see what other questions we got going on. There was a comment, wouldn't that depend on what you're eating every day? I'm not sure what you're commenting about, so just let me know. Okay, so some blood on poop normal. Okay, so I did mention this with red poop. I had talked about red poop. So is it normal? Generally, you don't want blood in your poop, but it could be if you had something like a hemorrhoid or a fissure, which is a crack in your skin in the rectal area. So that isn't as harmful as, let's say, if there was inflammation and colitis going on, if there was cancer, if there was a bleed. That is not something you want. So if you are experiencing blood in your poop, it's always good to get it checked out. Okay, so we just had some people joining us. So hi everybody, welcome. This is Let's Talk Health Live. I'm Dr. Amanda, naturopathic doctor. If you are new here, I do this live every night where I answer your health questions. You guys put them in the chat and I answer them for you. So if you haven't joined us before, be sure to like this video, be sure to subscribe and turn on your notifications so you get notified when I go live. So thank you so much. So somebody was just mentioning that they eat beans and lentils every day. They're gonna try adding different vegetables. Yeah, and then you can even add different herbs. Herbs are great too. So if you're making a lentil soup, go ahead and add oregano or parsley or thyme. Herbs are really good for improving your microbiome too. So somebody's saying they're having some sinus pain on the right side of their face. What is something that can relieve a really bad sinus pressure? So if you're having sinus pain, sinus congestion, one thing you do want to make sure is it's not a sinus infection. So that would be if you're experiencing other symptoms like fever or a lot of mucus, you want to maybe go get that one checked out. But in terms of just helping out with relieving sinus pressure, you could do a steam inhalation where basically you're using steam from boiling water. You can add some essential oil and just kind of breathe it in to help with clearing out your sinuses. That's just going to be something that's just going to help kind of temporary, but in that case I would recommend to get it checked out. All right. Okay, so I think we've answered a lot of the questions, and thank you guys for the likes. I just appreciate that so much. Thank you for your questions and joining us here on Let's Talk Health Live. I do appreciate everything that you guys say and that you do and that you're here hanging out with me. So, okay, so if there's any other questions, write them down. So in terms of poop colors, I talked about green, I talked about red. So if you didn't hear those, let me know. The other one I want to talk about is kind of yellow or orange. If you're having yellow or orange poop, is that normal and what does that mean? So generally we don't want to be seeing yellow or orange poop. You want to be having either that range of brown, maybe a little bit of green is okay. But if you're noticing yellow or orange, this could be that there's a lot of fat in your poop, and that means you might not be absorbing and digesting your fat properly. So a couple things you want to look at is your liver and your gallbladder health. Have you had your gallbladder removed? Do you have something going on with your liver? Like if you have liver inflammation, is there something wrong with your bile production? That's going to make me think, okay, that's why your poop is either yellow or orange. It's more fatty. Celiac disease, if you have celiac disease or really strong gluten sensitivity, then you could potentially also be having that yellow or orange poop. So if there's anybody else, or if anybody has experienced that, let us know in the chat if you had yellow or orange poop. Could also be due to medication. Sometimes it will cause that. Okay. What else? How does flexibility help with health and yoga and stretching? Yeah, so when we're thinking about like physical health, flexibility is so important. And I maybe like it's great that you brought it up, because sometimes we always focus on muscle, and muscle is so important because it helps with, you know, supporting your bone health. It helps as you age with supporting muscle mass, which is great. But if we think about flexibility, the reason why that can be important for our health is it can help more with balance. It can help with, let's say, when you're, you know, need to bend over and tie your shoes, or you need to go and grab something. The more flexible you are, the more that less tension you have, it can be helpful so you're not prone to things like falls. I would say that would be even like in the long term as you age, it's a great weight for like anti-aging is to making sure your body's more flexible. Yoga, stretching, same thing there, helping to really reduce muscle tension. Our like nervous system and our muscular system are connected. So if our muscles are nice and relaxed, then you know our nervous system will also be nice and calm as well. So great question there. Okay, so anybody's just joining us, hi and welcome. This is Let's Talk Health. I'm Dr. Amanda. I'm a naturopathic doctor and I host these live every night. So if you are new here, be sure to subscribe and turn on notifications and like the video. Thank you guys so much. And then ask your questions and I will answer them for you. Okay, I've never had diarrhea in my life. Is that a good thing? Yeah, I would say so. Like you don't necessarily want diarrhea. You want your stools to be nice and formed and you want to be going 1 to 3 times a day. You want them to be easy to pass. They shouldn't be loose and watery and they shouldn't be super hard. So if you haven't had diarrhea, that's great. I would say lucky you. Most people have had some sort of diarrhea experience. So, okay. What's up with poop? We're just talking about different colors of poop. So I already talked about brown and green and orange and red. Why don't we talk about black poop? So what does it mean if your poop is black or if it's really, really dark, what could that mean? So one thing that comes to mind for that would be supplements and medications. So iron can cause black poop or like really dark poop. So if you are taking an iron supplement, even if you're taking maybe a multivitamin, it might have something in there. Something like Pepto-Bismol can definitely cause black poop. And sometimes even just other medications might change the color and make it look darker. So in that case, that would be considered a normal cause of black poop if you are having it due to medications or supplements. So that's fine. But what else can cause black poop? Well, it could be blood. It could be blood from like an upper GI bleed. So that means like a bleed happening either in the esophagus or the stomach rather than in the colon. Usually if there's bleeding in the colon, it's gonna look red. So if you constantly have black poop, if you haven't had a supplement or medication that can cause it to be black, or if you haven't eaten something that might cause it to be black, then you wanna get it checked out. What else? In terms of like foods, so things like Oreos, Oreos can really cause black poop. So if anybody has ever had an Oreo or, you know, a few Oreos and then noticed their poop was black, let us know because that's a common cause. Sometimes even like chocolate cake or cake that has like coloring in it can cause black poop. So those would be the top ones in terms of black poop. Okay. So yeah, so if there's any questions about, if you didn't hear any of the previous colors, then let me know. So, okay. What else? Black, we talked about yellow, red, gray. Gray is another one, or like white or clay colored. That's not good. So if you've ever noticed like white, or if you currently are noticing that gray, a pale, really pale colored stool, you definitely want to go get that checked out. That's not good. Usually what means is there's like a blockage in the liver, the gallbladder duct, and you're not getting bile, and bile is what gives your poop a certain color. So it could definitely be something like that going on. Okay, so yeah, we're talking about poop colors tonight. So if anybody's just joining us, hi and welcome. This is Let's Talk Health Live. I'm Dr. Amanda. I'm a naturopathic doctor and I host a live Q&A where I answer your health questions. So feel free to drop your questions in the chat. And if you are new here, be sure to subscribe and like and join our health community here. So somebody was panicking when they had the 8 beets and they forgot. So yeah, beets can cause like red poop. They can cause even red urine, and a lot of times people forget that happened and then they start freaking out. But yeah, always go back and think about what did I eat and like could it be causing my poop to be a different color. Have you come across studies looking at cancer and parasites? No, I actually have not come across studies looking at cancer and parasites in terms of if they're correlated not anything that I have come across yet. Does poop color affect your intestines or colon? I wouldn't say like the color is causing an impact on it, but there's something that's causing the color, if that makes sense. So I would say it's the opposite, like the health of your colon or intestines or what's going on in there is what's making the poop a different color or what's causing it. So if you were to eat something that had natural like food coloring in it, for example, like beets, and it's making your poop red, that's not going to cause harm to your colon. Now, let's say if you were eating things with a lot of food coloring in them, like constantly eating food coloring, that's not the greatest thing for your body and your health, right? Because it's like an artificial coloring agent. So that's what I would say. Okay. Yeah. So what else? Red, I think we went through pretty much all of the colors. Now, sometimes you could even have like random color, like blue, okay? If you like blue poop, it can happen. It can happen if you've had something that has like blue food coloring in it. You could notice blue in your poop. If you take like B complex, B vitamins, sometimes you could get like a more yellowy, like greenish poop, and that could be from what supplements you're taking. So that's just what I would say in terms of poop colors, just keeping an eye on it. You know, I always recommend look in the toilet after you've gone. It's a great way of knowing about what's going on with your health. So yeah, and then that way you can see what poop color you had, what it looks like, and that can tell you a lot. Okay, so I'm gonna keep the chat open for another minute or so and then answer any questions you guys have. And as I mentioned, if you are new here, be sure to subscribe and join our community. I do this every night, so I try to go live around this time, but if you know it happens that I have to go earlier or later, if you are subscribed and you have notifications turned on, then you'll get notified. Okay, what about black poop? Yeah, so I was just talking about black poop, so you may have missed that. I'll just quickly go over that one again. So if you have black poop, it could be, let's say, due to a supplement or a medication, okay? So I was talking about iron, talked about Pepto-Bismol, some other supplements can cause it, other medications. So that would be like my first thing is looking at that. The next thing could be something you ate. So for example, Oreos I had mentioned, or anything that has like a darker food coloring in it, even things like chocolate sometimes can cause it as well. So I would say looking at what's going on there. Most likely it's probably due to that. You know, on the more concerning side, it could be you have a bleed going on in your upper gastrointestinal tract. So probably due to either like something you're eating with food coloring or something that's really dark, that can be causing it. Yeah. All right. We got some subscribers. Thank you so much, guys. I appreciate that. And thanks for the likes. Beets usually would turn it like a darker browny red. Yeah. Castor oil for good elimination. So in terms of like castor oil, I don't recommend taking it internally, but I do like it for where you put it over your abdomen, and it can help with regulating bowel movements. Great for your liver health. Yeah. Okay, guys. Thank you so much for tuning in tonight. That was Let's Talk Health Live. So as I mentioned, if you are new here, be sure to subscribe and join our health community. And I'm gonna wrap things up for tonight, but I will be back tomorrow. And if you have a question tomorrow or the next day, I will answer it for you. So I hope you all have a great night, okay? Bye and take care.